I'm Susan Cunningham, and I believe without being on this clinical trial, my disease would have progressed and I would now be facing a terminal diagnosis. I was diagnosed with locally advanced breast cancer in 2005, which is 14 years ago. When I went onto the trial, I knew I was going to get the treatment that my oncologist was recommending. I didn't know whether I was going to get the trial drug or a placebo. But what it has meant, due to the side effect profile, I know that I have been on the active drug, and I'm very grateful for that.
So breast cancer is the most common cancer in the world. There are around about 55,000 new cases each year in the UK, and the most common form of breast cancer is the estrogen receptor positive breast cancer, accounting for around about 70 to 75% of new cases. So this trial has been designed to help those patients to try and overcome mechanisms of hormone resistance, and therefore potentially this may have an impact on tens of millions of patients around the world going forward.
So the FACTION trial was successful. The patients who were treated with the capivasertib had a longer time to disease progression, so it took about an average of 10 months for their disease to progress compared to those given the placebo treatment whose time to progression was about 5 months. It's a really positive moment in research because we weren't expecting to find such a brilliant difference, and we've found a larger difference than we were expecting to see.
So FACTION, the trial involved around 150 patients, but in order for this to change standard of care around the world, we need a lot more patients to confirm what we've already shown in this trial. And that will probably involve a phase 3 trial that will be carried out across the globe. This trial is big news for Wales because there is a very heavy Welsh involvement. I'm a Cardiff-based chief investigator. The trial itself was sponsored by Velindre Cancer Centre, so that's a Welsh NHS organisation. And also the research was carried out in the collaboration with the Centre for Trials Research, which is a part of Cardiff University.
I feel that clinical trials are very important. I come from a medical background, and I feel that research is the way forward to give not only myself but future generations hope of, if not a cure, then at least an extension of life.